This morning, I want to talk about high blood pressure. Yes, I want to talk about high blood pressure. Anytime blood is mentioned, what comes to mind? The cardiovascular system, right? Okay, so let's have a brief of the cardiovascular system. The cardiovascular system essentially is composed of three major components or three major parts. You talk about the heart, you talk about the blood vessels, and then you talk about the blood itself, right? The heart, as you all are aware, it is a powerful muscle that pumps blood round the body, throughout the body. Now, the blood vessels, they are just the tiny pipes that convey bloods and nutrients throughout the body or to different parts of the body. Now the blood vessels are composed of three parts: arteries, you have the veins, and then you have the capillaries. Capillary, they are just the tiny blood vessels that you know ensure that nutrients and blood are delivered to the tissues and muscle. And then when you talk about the arteries, they are a very large blood vessel or vessels that carry blood, oxygenated blood essentially, away from the heart. Now you talk about the veins. The veins are equally large blood vessels that carry deoxygenated blood back to the heart. That being said, let's talk about blood, or maybe we talk about the component of the blood vessels. Of course, the blood vessels, they have about three components. You talk about the outer layer, the middle layer, and then the inner layer. The outer layer is called the adventitia. What the adventitia does essentially is to confer a level of structural support and shape to the blood vessel. And then we talk about the tunica media is the middle layer of the blood vessel, and the work is to ensure that the internal diameter of the blood vessels is maintained. So tunica media maintains the internal diameter of the blood vessel. And then when you talk about that part of the blood vessel that ensures frictionless pathways or frictionless movement of blood around the body is called the tunica intima. That being said, let's talk about blood. Blood, again, it has three components. Remember, we are just giving a summary. Blood has three components. You have the red blood cells, the white blood cells, and then the platelets. The white blood cells, like support immunity, ensuring that we are kept protected from infectious diseases. And then we talk about the red blood cells. What they do is to carry oxygen around the body. Now, and then the platelets. Crucial when you talk about homeostasis and blood clotting. They are responsible for blood clotting and then the arrests of bleeding, essentially. That being said, let's go back with that little, explanation. Let's go back to what high blood pressure means. High blood pressure, we can liken high blood pressure to the tension that builds up in a water hose. Yes, in a water hose. If the hose is too tight, the water pressure will be high. And if the hose is loosened, the pressure will drop. So the hose equates the hose with the blood vessels. The hose in this water scenario represent the blood vessels in our body. So if the blood vessels are, if they are too tight, it will lead to increased blood pressure. And if they are loosened, the blood will flow freely, lowering the blood pressure. That being said, can you think of any intervention, a natural intervention, that can naturally bring down blood pressure? Either fruits or vegetables around you. Well, what comes to my mind is what we call beetroot. Beetroot, you know, um, is easily accessible and is one of these plants that, or fruits, yeah, plants actually, that can actually lead to or facilitate the vasodilation that will allow blood free flow of blood. Yes. So what it does, beetroot contains a lot of nitrates. Although there are other phenolic compounds that you can find in beetroot, like the arpigenin, your beta-garine, your chlorogenic acid, and a whole lot of that. But I just want to focus on nitrates. Now, beetroot is packed with a lot of nitrates, and anytime we consume beetroot, the nitrates is converted to nitrites using the our oral microbiome, or the beneficial bacteria in our mouth. The beneficial bacteria in the mouth essentially converts you know um, the nitrate to nitrites. Now this nitrate eventually undergoes a couple of decomposition to form what we call nitric oxide. Nitric oxide is a powerful vasodilator. In fact, it is a primary and the first vasodilator when you talk about beetroot. Now, this nitric oxide will activate an enzyme in the blood vessel called the soluble guanine cyclase. This enzyme will facilitate, the conversion of guanosine monophosphate or guanosine triphosphates to cyclic guanosine monophosphates. So, soluble guanine cyclase will facilitate the conversion of guanosine triphosphates to cyclic guanosine monophosphates. Now, anywhere there is buildup of cyclic guanosine monophosphates, the blood dilates. So a buildup of CGMP will lead to vasodilation. So anytime you consume beetroot, you know that it is, facilitating the dilation of your blood vessel. Now, there is something we call biomimesis. Biomimesis is essentially the imitation of natural processes to advance human objectives. Yes, the what? Imitation of natural processes to advance human objectives. So you can see how the body functions or how something in nature functions and try to simulate it outside the body or outside the natural process. So in that case, in pharmaceutical industry, we have a lot of interventions that can actually mimic either the nitric oxide, the natural nitric oxide obtained from beetroot, or the cyclic guanosine monophosphates that will maintain the relaxations of the smooth muscle that will facilitate free flow of blood. And one example is the alpha 1 beta receptor, or rather alpha 1 beta blockers. We have alpha 1 beta blockers. The alpha 1 beta blockers, a notable example is prazosin. Alpha 1 beta blockers block the alpha 1 adrenergic receptors, preventing sympathetic vasoconstrictions signals, leading to vessel relaxation. So it is all aimed at what? Vessel relaxation that will facilitate free flow of blood. Now, when you talk about angiotensin 1 or angiotensin enzyme inhibitors, angiotensin converting enzyme inhibitors, example, your enalapril, your lisinopril, what they do is to inhibit the conversions of angiotensin 1 to angiotensin 2, reducing vasoconstrictions and causing vasodilation. Then there is one we call the angiotensin 2 receptor blockers. If you have ever taken Vasatan or Losartan, what they do essentially, they are mimicking, the work of nitric oxide or the work of cyclic guanosine monophosphates in beetroot. Look at what they do. They block angiotensin 2 receptors, directly preventing vasoconstriction and promoting vessel relaxation. So all is aimed at what? Vessel relaxation. What about calcium channel blockers? Amlodipine, the verapamil, if you have ever taken any of these drugs, all they do essentially is to prevent calcium entry into vascular smooth muscle, reducing contraction and promoting vasodilation. And then we have what we call the direct vasodilators. Example, the hydralazine and minoxidil. They act directly on vascular smooth muscle to relax arterioles independent of the neurohormonal pathways. Remember, the minoxidil is one of the drugs we use for, non-cicatricial alopecia. Yeah, non-cicatricial alopecia is reversible. It's the type of alopecia that is reversible, type of alopecia that um, that hair can still regrow, but we use minoxidil essentially, to facilitate, hair growth when you talk about non-cicatricial alopecia. But minoxidil will never work in a cicatricial alopecia because it is irreversible. Now we talk about endothelin receptor antagonist. Yes, when you hear of the bosentan, the ambrisentan, the mesentan, what they do is to block the endolin 1 because endolin 1 is a potent vasoconstrictor. And by blocking it, it will lead to what? Vasodilation and then free flow of blood. What about phosphodiesterase 5 inhibitors? If you have ever taken sildenafil, if you have ever taken tadalafil, what they do is to inhibit the breakdown of the cyclic guanine monophosphates. Yes, because once there is a buildup, remember I told you there is a buildup of cyclic guanosine monophosphate will lead to the relaxations of what smooth muscle, which will facilitate free flow of blood. But the moment that is broken down, you know, your blood, the vessel will collapse, and then free flow of blood will be obstructed. So, PDE5 inhibitors essentially inhibit the breakdown of cyclic guanosine monophosphates. And by so doing, you're having free flow of blood. Now we have what we call aliskiren. Yes, aliskiren is one of the examples of renin inhibitors. And what they do is to block renin activity, suppressing angiotensin 1 and 2 formation, ultimately leading to vasodilation. What about alpha 2 agonists? You have ever taken metidopa or clonidine, what they do essentially is to limit your sympathetic outflow, lowering vascular tone and causing vasodilation. Remember, I told you earlier that if you are in a sympathetic dominant phase, you are essentially in a crisis state, essentially in a fight or flight mode. And drugs are designed essentially to inhibit you from falling into the sympathetic dominant phase so that there will be free flow of blood. Because once you are in a sympathetic dominance phase, it will lead to constrictions of blood vessels. It will lead to increase in your cholesterol. It will lead to crisis states. So that is just a succinct comparison of um, beetroot and some modern medical intervention we use in controlling high blood pressure. Thank you.